Using MRD to personalize care for myeloma patients is increasingly thought of in clinical practice. This is being tested within large cooperative studies. There are a few ideas about using MRD in clinical practice. One of that is to look at de-escalation of therapy. So in the RADAR study, we're looking at giving defined duration of maintenance treatment based on duration of MRD negativity in transplant-eligible myeloma patients. The second is there are a number of trials also looking at MRD positivity in patients who are MRD negative to start treatment at this time point rather than waiting for the disease to relapse either biochemically or clinically in patients. These are probably two key areas that we'd be looking at change in clinical practice. Already we know that about a third of patients with myeloma on maintenance treatment struggle to stay on therapy for long. And therefore, using MRD to give defined duration of maintenance treatment is certainly a practice that would soon come in if that is supported by clinical trials. With regards to using MRD to determine a change in therapy or starting new therapy, this certainly does require support from clinical trial data. But what patients are being put through at the moment is those patients with high-risk disease who remain MRD positive on a certain line of therapy are being changed to a new line of therapy to try and change them to MRD negative, which improves the prognosis of the patient. So these are the areas where MRD is going to be increasingly utilized in clinical practice for the management of myeloma.